Hello, I'm Michael Margolis. I'm a biological dentist in Mesa, Arizona. And I'm here to talk to you about zirconium oxide implants. Yesterday I saw a patient who had 4 titanium implants that all had to be removed because his body rejected every one of them. And he asked me if he was a candidate for zirconium oxide implants because he's just having so much trouble trying to eat, and he has a difficult time using a removable partial denture. So I didn't know. So what we did was we ordered a blood antigen test for him called a Clifford material reactivity test. There are other tests out there, biocompatibility, and in Europe they use a MELISA test, M-E-L-I-S-A. And they will tell you if the patient has a blood antigen reaction to these materials. I tell my patients that I don't like using any metals in their mouth. Any kind of crown that might be based with porcelain over the metal, a full gold crown, a removable partial denture that is based with a metal base, or any type of metal including titanium implants. A zirconium oxide implant is this product right here. It is a crystalline form of zirconia, and it's a crystal or a ceramic that we place inside a patient's jawbone. So what we have to do for that patient is first check to see if there's a biocompatibility with them and the material. We also do energetics to recheck the product to make sure that it is compatible with everything else in that patient's body. Then what we do is a radiographic examination of the patient. We take a 3D cone beam Galileos X-ray so we can measure the bone thickness, width, and depth to see if an implant will fit. We also take study models to make sure that an implant could be properly orientated according to the X-rays so it can be placed safely and soundly in the patient's jawbone. From there, what we do after everything's been evaluated and the patient is okayed for that material, we go ahead and do the surgical procedure after checking the size, shape, and length of the implant. And then, of course, we plan the surgery out with a surgical model that will guide us to place the implant. Multiple X-rays, which are digital in our practice, are taken to make sure the orientation of the implant is in accordance to the teeth around them and the sinus and or the nerve in the lower jaw. And then we place the implant in steps, increasing the depth and the size and width of the hole that the implant is going to be placed in, going from a smaller size to the size that the implant will be. Once it's determined that it's safe and everything is placed properly, we will take what is called a protein-rich fibrogen that we have drawn the blood from the patient prior to the surgery, and we'll spin it in a centrifuge which will separate the blood from the plasma and the fibrogen. Then we process the fibrogen so it can be placed in the hole where the implant is going to be placed, and then place the implant appropriately. This will squeeze the fibrogen between the implant and the bone and take up any space that might be void alongside of it. Then what we do is we place a protective splint over the implant for a period to 3 to 6 months, depending upon if it's the lower jaw, 3 months, that's when we can place the crown, or the upper jaw, 6 months, which takes longer than the lower jaw. Then we place that crown. The whole process depends upon the individual patient. We will sit down with you, review the findings of what your overall health is, your biocompatibility to materials, and your overall oral health to make sure that this is going to be a good move for you and fit your needs. If you have any questions or would like to know more about the zirconium oxide implant, please give us a call at 480-833-2232 or contact us via the internet at info at mydentistaz.com. We look forward to working with you and helping you to achieve good oral and general health.